عليكم السلام ورحمة الله.
حيا الله جميع الشباب، كيف الإجازة معاكم؟ الحمد لله. طيب، بنبدأ إن شاء الله نعطيكم اورينتيشن بكيف مرت سنة رابعة معنا. هنشرح لكم إن شاء الله تجربتنا أنا وزملائي عمر وأنس. الشرح كله حيتم يعني على حسب تجربتنا الشخصية. بإذن الله تستفيدوا منها وتاخذوا أي أغلاط إحنا ارتكبناها وتصححوها إن شاء الله. إذا في عندكم أي أسئلة خلال البرزنتيشن عادي ارفع يدك واسأل معنا. طيب، أول شيء علي صوتك، ما سمعتك حسن. طيب welcome all. We will talk about our experience in the fourth year. Me and my colleagues Anas and Omar. We will explain our experience with this year. We will not give any new things. You may have changes in your year since we are already back from the Corona time, alhamdulillah. So if you have any questions during the presentation, don't hesitate to raise your hand, and then when we give you a permission, just ask it. Okay, in introduction, we need to know that this year is very much different from the previous years. It's now time for change to the serious topic, to the clinical topics, and you already passed a lot of, let's say, steps before. And now I congratulate you all for reaching to this step. So you are building your own success in the medical career. Okay, without further ado, let's enter to explain the main rotations and non-rotation things in this presentation. Could you please move on? Okay, at the beginning, we have rotations, as we said. There are no clusters anymore. We call it rotations now. And then we have non-rotation courses. In the rotations, we have in the year 6 rotations. We will talk about each one. We will explain our experience in details in each one of these rotations. Regarding the non-rotation courses, almost all of them are repeated courses, and you already have an experience on them. So we will just highlight if there is any differences and give some advice on this. Okay, next. Starting with the health ethics, there are no much differences in health ethics. You will just take, first of all, an introduction. Could you please go to the next slide then, Amar? Okay, there is nothing new. The responsible doctors were Dr. Shahid and Dr. Amal. The attendance is very, very important in the Hilhi. Almost the doctor will give you a grade, and if you are absent, he will substitute from your grades. We need to know that there are 5 rounds of Hilhi. That means you need to make a team and make 5 presentations with the big rotations. It has 1 credit hour, and these are the proper sources you may use when you're doing the Hilhi. We will not explain how to do the Hilhi because you already experienced on that. Okay, next. Okay, regarding the CAT, our critical appraisal of topic, this year is, let's say, it's different year. There is a new topics that you're gonna learn in the basics of research. You will reach now at the first half of the year, you will take the systematic review and the meta-analysis. You will do an assignment for that. And after finishing this assignment, you will take a final exam and the mid-exam. And according to the results of these exams, you will be graded in the CAT. So you will finish this course by the half of the year, by the first half of the year. Then you will be asked to make a groups between of you all. Our groups were about 11 to 14 students for each group. These groups need to mindstorm and find topics and then write a proposal for this topic for the research, for the final research that you will work on in the 5th year. Regarding the doctors who was responsible for this course, they're gonna change, I think, because our supervisors are not now in the college, so we don't know about the doctors that will supervise your course. The attendance is very important for this course. Each Wednesday you should attend one session of that and make the assignment. It has 1 credit hour for this year. The next. Okay, we have reached to the progress test. Okay, we have a right hand. Okay, go ahead, Lina.
So, excuse me, regarding the CAT assignment, how is it like? Is it like the presentation we used to make, or is it some draft?
Yeah, you will make the same assignment that you have did before. Let's say that you will search about systemic review and meta-analysis, an article, and then you will critically appraise this article at the same way that you have did before in the third year. Did I answer your point?
Yes, thank you.
Okay, we have reached to the progress test. The progress test, as we all know, it's a headache for most of the students. And to be honest, there is nothing other than a practice that will improve your grade in the progress test. So you need to just solve the previous question and take it step by step. You will need to read each question in the progress test carefully. Don't just pick any choice. Most of the questions will give you a hint about the answer. Could you please go next, Omar? Okay, as I said, you need to practice more than studying. Just practice the questions, see the question scenario. Never choose something without knowing any knowledge. We have 4 international progress tests and 1 national. This have 2 credit hours. And practice. This is my advice in the progress test. We go next. Regarding the last 2 non-rotational courses, we have the professional behavior and the portfolio. I think we already know how these courses are done. Professional behavior have 2 credit hours in the 4th year. In the time of, let's say, submission is very important. And the supervisor for this course is Dr. Shahid. Regarding the portfolio, don't miss your meeting. Create a wonderful CV. You can use many, let's say, many websites. One of them is Canva to make a CV. Take a copy of everything that you will use in the 4th year. This is very important. So when you have, at the next slide, we will talk about something called mini CX and some work paper things. So just when you finish from them, take a picture for these things so you can add them to the portfolio at the end of the year. Start to make the portfolio as early as you can. Take it step by step so you don't, let's say, you don't reach to the end of the year and you don't start from the beginning. 2 credit hours for this course. Okay, next. Okay, we have reached to the surgery. The surgery will be explained by my colleagues Anas and.
Okay, thank you, Albara. Is my voice clear?
Yes, clear.
Okay, good. Assalamu alaikum, everyone. Good evening. I hope that you're having a great vacation, and I wish you the best of luck in your coming year, which is the, let's say, the most difficult and beautiful year at the same time. Okay, now with surgery, the doctors that was the supervisors of this rotation were Dr. Uthman, Dr. Zulfaqar, and Dr. Amna, and Dr. Junaid. Dr. Junaid left the college, so I believe you will have your surgery rotation with the first 3, Dr. Uthman, Zulfaqar, and Dr. Amna. Okay, next please, Omar. So this rotation consists of 14 weeks. You can see here the titles. The first one is preparatory week. The second one is about perioperative management for surgical patients. The next 4 weeks will be about abdomen. In each week, you will take a different subject. For example, in the first week, you will have the esophagus and stomach. The second one, you will have hepatobiliary diseases and surgical cases. After that, you will have the intestines and appendix, and later you will have the rectum and anal canal. After that, you have the urology week, thyroid and endocrine week, breast, vascular system, trauma, and the last one about skin and subcutaneous tissue and neurosurgery. The order of these weeks may differ. So, for example, one batch, we have 2 batches in our groups. So each one started, the order was different for each batch. So that you may start, for example, with skin and subcutaneous tissue because it's slightly easier than the abdomen weeks. Anyway, these are the 14th. The last week will be you will have your exams, your OSCE, OSCE, and we will talk about these. Next, please. It has 10 credit hours. So this rotation and the internal medicine rotations are the largest and the most important rotations maybe in your whole college journey. I really advise you to work to give all the hard work that you can give in these 2 rotations, especially the surgery and the internal rotation, for your marks and for your GPA and for your future life as a doctor. Sure. Yes, someone next. Okay, so the week structure in this surgery, of course, self-study, which is obvious. We have hospital visits and case of the day. We'll explain what's the case of the day. You will have also some lectures, seminars, and supers. In your typical week in the surgery rotation, you will have 3 days in the hospital. You will visit the hospital, the surgical male and female wards. Some of you will go to the outpatient clinic, and others may attend the OR, the operation room. At the same time, at the same day of the hospital visit, you will discuss something called the case of the day. For example, you will have a table from the beginning of the rotations. It will be shown to you that the case of the day, for example, on this day will be about, for example, let's say urethral stricture, for example. So it will be assigned to one of you, or to one student who will come prepared, who will come prepared for this case, and you will discuss this case from the beginning, from the presentation of the patient. What are the signs, symptoms, and what is your approach as a doctor? Your history, physical examination, investigations, and the treatment. So each day you will discuss one special case of the day, besides the cases that you will see in the hospital. For example, let's say that you went to the hospital, you had 3 cases, let's say hernia, intestinal obstruction. You will discuss all of these, plus the case of the day one. As I said, the case of the day, it will be prepared by one student, and it has some marks on it. So he should be prepared very well for this case of the day. You will also, after that, you will finish your hospital visit. You will come, for us, it was online, the seminars. This year, it might be you will have it in the college. You'll attend it in the college. So you have a seminar. Also, the seminars will be distributed among us. You will have a table of seminars, the different topics, and each topic will be assigned to 1 or 2 students who will have their seminars prepared, and they will present it to the other students. Also, the seminars, it describes the approach. For example, the topic of the seminar will be about a specific presentation. Let's say abdominal pain, or let's say hematemesis, let's say coughing. Of course, it's not surgical, but like this is an example. It will be a presentation. You will prepare this seminar as an approach. You will first describe the presenting symptom, You will describe your differential diagnosis. You will describe then your history, physical examination, investigations, and treatment. Your approach, like if you were in a hospital and a patient comes to you with this complaint, this is the seminar. So all of these will be done in the hospital day. You have 3 hospital days in a typical week of a surgical rotation. You will have 1 day for lectures. The number of lectures differs also. For example, our batch, we had very few lectures, very few, that didn't like cover, it covered very few topics. But the other batch had many lectures, so it will differ, I believe. And 1 day for your supels. Supels, it's like always, you will be given a topic and you will prepare it and present it. Each student will present a supel. During the surgical rotation, you will have like a few supels and a few lectures, a few supels and a few seminars. And case of the days that you will present and you will prepare. Okay, Ibrahim has a question. Yes, Ibrahim.
يعطيك العافية أنس. Question regarding the case of the day. The topic of this presentation will be new or repetition for some topics in the SUBEL?
It will be new, most likely.
طيب.
Yeah, yes. That's why you will have many different topics. You will have lectures with different topics. You'll have case of the days with new cases and new topics. Seminars and supels, all of these are different cases. It will be, of course, within the theme of the week. For example, if the theme was about abdomen, let's say stomach, for example, and esophagus, it will be a disease that affects, for example, stomach or esophagus. But yes, it will be different. Yeah. طيب, Tamim has a question. Yes, please.
طيب هلا يعني we have 3 seminars, 3 case of the days in 1 week?
Yes, 2 or 3. Actually, it depends. For example, in our case, because of the corona pandemic, we started with 3 days. After that, some weeks we had 2 days. Later on, in some weeks we had only 1 day at the hospital. So it may differ the number of days. For example, you may have in 1 week 3 days, the next week 2 days, and alternatively, 1 week 2 days hospital, the next one 3 days, the next one 2 days. So this was the typical hospital day in our case.
تمام.
طيب. So تمام, هيك عندنا 5 days, 3 hospital days. In some cases, it may be 2, depending on your situation and in the director's decisions. You will have probably 1 day for lectures and 1 day for supels. Supels, seminars, case of the day, all of these are presented by students. تمام. طيب, next one, please. طيب, تمام. هلا, let's say this is the week structure. For example, you will have, let's say, if you have your hospital days, we had, for example, on Sunday, Monday, and Wednesday. Okay, أحد اثنين أربعة. So, for example, on your Friday and Saturday, before these days, before your hospital days, what should you prepare? You should prepare your approach, your clinical approach, your history, your physical examination, and you should review some surgical cases that's related to the theme of the week. Also, you will review the seminar and case of the day that are assigned to this hospital day. As I said, you will have like a table that shows, for example, at this day, we will have seminar about, like, let's say, as I said, hematemesis, and a case of the day about, let's say, urethral restriction. So before your hospital day, you should come prepared with your clinical approach, history, physical examination, of course. You should be prepared about the seminars and case of the day of that day, and review the surgical cases that's related to your theme. So, for example, you can review and take an overview about these surgical cases from a pocket book, not from a large book, before your hospital days. Okay, so that if you were able to do this, it will be something very good and amazing. And you will participate very well with the doctors, and you will be active. If you are active, you will learn, of course, much more of course. On your hospital's days, you will stay in the hospital for about 4 hours. That was our case, from 8 to 12 p.m., from 8 a.m. to 12 p.m. Of course, the most important thing, notes, notes, notes. In all of the surgery rotation, in all of the internal medicine rotation, take notes. Notes in your hospital, in your seminars, in your case of the day, in your lectures, notes everywhere, because focus on what the doctors are mentioning and what are focusing on. If you were able to do this, and if you are able to take notes and focus on all of the topics that they mentioned, believe me, you will not lose marks, because almost every question that you will be asked, it will be mentioned by these doctors. And for example, Dr. Zulfaqar likes to repeat the topics many times. So focus on what the doctors are saying and take. So you will say 4 hours. You will take history. You will go to patients. You will take history and do physical. After that, you will go to the doctor in other places than you work. And you will discuss this case with the doctor. You will tell him the history and physical examination findings. After that, he will ask you about your differential, your investigations, and your treatment. That's it. That's for the hospital day. On your after the hospital day, on Tuesday, you will have probably your lectures day. So you can review or prepare the lectures day so that you can ask, and you can, it will be more easier to you later to study these lectures. On Thursday, usually you will have your supels day. So your colleagues will present these supels on one day, from 8 probably to 3, from 8 a.m. to 3 p.m. So yes, that's the typical structure of the week. Do you have any question about this structure? So 3 days for hospital, 1 day for lectures, 1 day for your supers. Try to prepare each of these topics before 1 day of these so that you can ask and you can take notes effectively. Okay. Yes, Lena has a question, please.
Excuse me, doctor. Regarding the lectures, you said we shall study them a day before. So are they going to be provided for us, or the topics of the lecture?
You will have the topics, of course, in the timetable. You can take, if many doctors don't like to upload their lectures before they present it, so you can get it from our drive or from previous year's files. Yeah.
Okay, thank you.
You're welcome. Any other question? Okay, Majid, تفضل.
Yes, يعطيك العافية. So I see the seminar have the same idea of the supels.
حلو. لا تمام. لا هني مش they are not the same idea. The seminar is the approach. The title of each seminar or the topic of each seminar will be a presenting symptom. Presenting symptom like what? So for example, you'll have a seminar about cough. You'll have a seminar about constipation. You'll have a seminar about diarrhea, for example, this in internal medicine. Here you'll have a seminar about, let's say, hematemesis. You'll have a seminar about melena. You'll have a seminar about hematochezia. Presenting symptom. مريض إجاك بسعلي. مريض إجاك بكح دم. تمام؟ هذا السمينار. فأنت بسمين Any other question? Yes, Lena. Go ahead.
So in the supel, we will be given the disease. Shall we describe the pathogenesis that we are given the specific?
Very brief, very briefly. يعني one slide, maybe. One slide about pathophysiology.
Okay, thank you.
Yes, Ibrahim, تفضل. Yes, إبراهيم تفضل.
ايوه بالنسبة ليوم الخميس حيكون في clinical skills صح؟
Yes صح. بس برضو بتعتمد يعني it depends the number of these clinical skills sessions depends, but yes, you may have clinical skills in the afternoon after your circles.
ايوه وحسب ما شفت يعني شفت التايم تيبل تبعكم بتكون يعني التوبكس تبع الكلينيكال سكيل يعني مثلا يوم الخميس للاسبوع اللي بعده
بالضبط.
فبندور بالمستشفى بنطبقها يعني.
Exactly. You will have your physical examination explained for the topics of the next week, most probably. And it's obviously it's very important to attend it because, as I said, each word that the supervisors say, it may come as a question in the exams. Even clinical skills, it may has very like much questions. And the physical examination, the techniques also, it will be given by those supervisors, so by the doctors. So, and try to attend everything. There is no chances for any like absence.
ايوه والكلينيكال سكيلز بيكون يعني شرح الدكتور كافي اذا انت حضرت ولا لازم تكون محضر وجاي؟
Yes, in most cases it will be enough, but it will make your life easier that after after this topic has been explained by your doctor, if you later read it from the book, it will be much more easier. You will راح تمر السريع على التوبيك. فيفضل it's better that you read a book about this physical examination after it has been explained by the doctor. But even if you take your notes effectively, yes, it will be enough for you. You will do great. Yeah, but of course it's better if you have the chance to read it from a book later, because you will راح تمر السريع سهل.
تمام.
طيب, next please. تمام. So, as we said, in the typical hospital day, you should prepare your approaches, your history, physical examination. You should read about an overview of the surgical cases that you may discuss of the theme, and you should prepare the seminar and case of the day of that specific day. These are one of the best books that you can use for your surgery. Browse Introduction to Symptoms and Signs of Surgical Diseases. It's a great resource. It's recommended many times from Dr. Osman. He loves it. And you will have many details, surgical details and concepts that is explained in this book that you may find difficult to find it anywhere else. So it's a great one, and it's an easy one. Each topic is explained maybe in 2-3 pages like this. So very, very important and a great resource to study from. Browse. Okay. Oxford Cases in Medicine and Surgery. This is for your approaches, for your seminars. It's a wonderful resource also. If you have any seminar or if you want to revise any approach for any presenting symptom, this is one of the best books that you can read from. But its problem is that it doesn't have all of the presenting symptoms. So if your seminar or if your presenting symptom that you would like to revise is present in this book, it would be amazing to read from it. If you didn't find it, you will use other books. For example, you have the above on the right, Churchill's pocket book, Differential Diagnosis. This is also for your approaches, but it gives you a presenting symptom, then it gives you the differentials and a few lines about each differential. It talks about it. So, for example, if you didn't find this presenting symptom or seminar in this Oxford one, you can use Churchill pocket book. it gives you a good idea. The 100 cases in surgery, it's very also a very good resource يعني, to study the topics. To study after, for example, you finish studying about your seminars or your seminars or your topics, you can review these topics from this 100 cases because it presents the topics to you as a pure cases. It will give you a case, for example, a patient, blah blah blah, and it will go one step by step. So it's very good one for if you have time and if you finished all of your studying, it's a great one to يعني, recap what you have learned. Okay. Churchill Pocketbook of Surgery. This is يعني, I really recommend this one. It's a must. يعني, this one to يعني, this book explains the surgical cases in a very brief way, and يعني, if you didn't have the time or if your exam is near and you didn't have the chance to read about certain topics, you can read it from here. Or if you want to prepare surgical topics, many surgical topics in a brief way, for example, before your hospital day, you can use this one. And I will tell you, for example, the main resource for you in surgery is Bailey and Love. I guess you all know it. You should have a plan B because it's very likely that you won't have the time to read each surgical topic from Bailey and Love because it's a very long and it's difficult to read book. So you should have a plan B and you should prepare yourself that you most probably that you won't have the ability to read all of the topics, all of the seminars, suples, lectures, all of the topics from Bailey and Love. So you can use this one instead. It gives you a very good idea about these topics, and I believe it's يعني, enough in most of the cases. Most of the cases you won't have a question out of this one, plus the notes of the doctors. I believe it will be more than enough. You have also the patient history. It's purely for your history taking. It's amazing also for your seminars and for your clinical approach. Yes, please. Next. طيب, Muhammad has a question. Yes, please.
Yes, Anas. Which book, if I want to choose one book from all these 6 books, which one do you prefer for both? And are they good for clinical rounds and for the SUBEL, for preparing for both?
Okay, very good question. يعني, the problem is that each book has a certain like goal or idea, or it can help you in a specific way. For example, the Oxford Cases in Medicine and Surgery and Differential Diagnosis, Churchill Pocketbook Differential Diagnosis, these one are for your approaches, for your seminars, okay? The patient history is for your history taking in the hospital. So that if you have any patient who comes with you with a certain complaint, you know, and you know what questions you should ask him. So the patient history is for your hospital and for your clinical exams, for your history taking. The Oxford Cases in Medicine and Surgery and Differential Diagnosis, Churchill, these are for the seminars. Okay, the Churchill Pocketbook of Surgery, the second one to the left, يعني below. This one is for your suples and for your general, يعني for any surgical topic. If you find it here, it will be amazing. And for your suples and your lectures, for any supple or lecture topic, you will find it here in the Churchill Pocket of Surgery. تمام. Browse for your clinical also. It will help you in many aspects in your clinical symptoms and signs of the surgical cases. So يعني فهمت علي؟ كل واحد له فكرة. السيمينارز بدك شيء غالبا راح تحتاج مصادر مختلفة للسيمينارز شوي، مصادر مختلفة للسوبلز وهكذا يعني. كتب لتطور من يعني من الكلينيكال ابروتش تبعك زي هذا البيشنت هيستوري وهكذا. يعني للاسف مصادر كثيره وانا عارف انه حمل كبير، بس يعني يعني the problem is that you should study the whole surgery in these 3 months. So يعني that's it. Yes, إبراهيم.
بالنسبة للكتب هي اللي بنحضر منها للسوبل اللي هو تبع الابروتش صح؟
تمام.
ايه يعني احنا مثلا بسنة ثالثة كان في بعض الأحيان مثلا في learning goals إنه يعني شيء له علاقة بالابروتش إنه كيف تبلش وهيك. فكانت مثلا كثير أحيانا تكون مثل عدد والله إنه عمل CBC عمل كذا عمل كذا. بكون مثلا إنه يعني ماني عرفان إنه ليش بدي أعمل هيك. فعلى هدول الكتب إنه بتشرح لي لا لازم نعمل CBC مثلا لأنه مشان كذا كذا وبنعمل مثلا إكستري لأنه محتاجين هيك وهيك فإنه بصير يعني بفهمه ليش مو أكثر ما إني أحفظه. فهل هو هيك الوضع ولا لا هو؟
ايه هذا الأوكسفورد كيسز من سيرجري هذا يعني ما بقدر أوصف روعته كم يعني بيشرح لك كل شيء بالحرف وبيشرح لك الأبروتش بشكل يعني ما طبيعي حرفيا. فاذا كان الموضوع تبعك مغطى فيه حيكون شيء اسطوري ويشرح لك كل شيء بيفهمك كل شيء يعني عرفت من الالف الى الياء. ولما تقرا خاصه مثلا براوز وكمان ساينز وسيمبتومز هذا لو قريت منه الامراض حلو راح تصير لحالك تفهم ليش انت عم تطلب هاي التحاليل بعدين عرفت وشو العلاقه وشو اللي عم يسبب وهكذا. هلا بخصوص هذا اللي هو التشرشل بوكيت بوك تبع السيرجري هذا زي ما حكيت هذا بيفيدك بالسوبلز اللي انت بدك تدرسها اللي مش عليك انك تشرحها تمام. اما اذا انت عندك سوبل بدك تشرحها لا لازم تشوف بيلي اند لاف طبعا بدك شيء ديتيلز وبدك تشوف اكثر من مصدر وتختم الموضوع يعني على الاخر حلو. بس هذا مشان السوبلز لانه مثل ما حكيت لكم عدد التوبكس يعني ما طبيعي تمام. يعني احتمال انه الواحد ما يلحق يدرس كل المواضيع من بيلي اند لاف كثير عالي. بدك تحط انت الاحتماليه دائما. فوقت اي توبك ما بتلحقها من بيلي اند لاف بتشوف هذا تشرشل بوكيت بوك اوف سيرجري. تمام. طيب next one please. طيب هاي the hospital days as we said you will go to the male surgical ward, female surgical ward, the outpatient clinic and the operation room. These are you will be like divided into groups and each group will go to a certain place with a certain doctor. Yes, please. Yes, these are the same. You will have your logbook. In this logbook, you will write the cases that you have seen in the hospital, and you should have it signed by the supervising doctors that was with you in the hospital. So, for example, you had a case about intestinal obstruction. You will be given this book from the beginning of the rotation. You will write that the presenting case or the case was intestinal obstruction, and you will have your supervisor or doctor sign this case. And at the end of the rotation, you should have a certain number of cases so that you can pass or you can get the marks of this logbook. It's all of the explained, as we said, history, physical examination of the cases that you see. You will discuss the case of the day, and you will have your seminars in the college or online after afternoon or after you finish your hospital. طيب any question about the logbook؟ وضحت فكرته؟ طيب تمام next please. طبعا notes مثل ما حكينا the most important thing any word or topic that the doctors explain take notes of their what they are saying to you. Take notes of the cases that you see in the hospital. Because they will assign you to certain cases. They will tell you go to room, for example, 13B. Okay. For example, that patient had intestinal obstruction. It was a case of intestinal obstruction. So also you should take notes of the cases that you have seen in the hospital or you saw in the hospital, because most probably you will be asked about the same cases in the clinical exams and in the your MCQs and MAQs cases, and take notes of what the doctor is saying. The most important advice probably we can give you for surgery and internal medicine. Yes. لأنه المشكلة the content it's الcontent كبير بشكل ما طبيعي تمام. It's the content is very heavy. So if you focus on what the doctor is focusing on, it will make it will make your life much more easier, so that you know on what to focus on, what to read, what to يعني عرفت. بتصير مثلا التوبكس اللي شايف انت الدكتور عم يركز عليها كثير ويعيدها ويشرح كثير كثير كثير، هاي شغلات يعني يفضل طبعا لازم تقراها من بيلي اند لاف، لانه في اسئله بتيجي بالنص من بيلي اند لاف ما موجوده باي مكان ثاني، او بيكون الدكتور حكاها، واحد من الاثنين. طبعا هاي الاسئله اللي كثير صعبه يعني مثلا واللي مش الكل بيقدر يجاوب، يا بتكون مكتوبه بالحرف بيلي اند لاف ما حدا انتبه عليها، يا بيكون الدكتور شرحها بالحكي تبعه. فلانه حكينا نحن الكونتنت كثير كبير وثقيل، اذا ركزت بكلام الدكتور بتصير تعرف شو الشغلات اللي تقراها من بيلي اند لاف وشو الشغلات اللي ما تقراها من بيلي اند لاف. لانك انت بيلي اند لاف يعني مثلا انت عندك هذا الموضوع معين، مثلا نوع معين من انواع الكانسرز او اي توبيك معين، تمام، بتفوت ببيلي اند لاف ويلا بتروح مثلا 20 30 صفحه، بتضل عرفت بتضل عم تقرا فيهم مدري كم يوم، بالاخير بتلاقيها ما كثير مهمه ولا ركزوا عليها الدكاتره ولا اجى منها اسئله. فلازم تعرف شو المواضيع المهمه اللي تقراها من بيلي اند لاف وشو المواضيع اللي تسحب عليها. تمام. طيب نكست بليز. طيب ليكشرات برضو مثل ما حكينا take notes وبس. يعني for our batch we had very few lectures, the other batch had يعني few more lectures. You will probably have more lectures than we had, so pay attention and take notes. That's it, yeah, for the lectures, nothing new. And try to prepare it from previous year's files if you have it. If you have the ability to do so, it will be amazing. Yes, please. The slide is not moving. Oh, yes, good. طيب. This one YouTube channel, Ali Hasib. يعني it's one of the most amazing channels that you can يعني study from. It explains most of the surgical topics, if not all of it. It will be amazing to view it if you يعني try as much as you can to organize your time and try to watch this Dr. Ali Hasib videos about the topics before you study it from Bailey and Love. Bailey and Love is a British book with a difficult language. So one of the most things that will help you in يعني حتى تمر من هذا الكتاب حلو هو it's amazing but its language is slightly difficult and it explains things like slightly in a difficult way. So if you can view these videos from Dr. Ali Hasib, or if you don't like videos, or if you didn't have the time to view these videos, you can read from the pocketbook Churchill that I showed you previously. You can read these topics in a very brief way, or from other book that I will show you, Matari. يعني إذا أخذت فكرة عامة عن الموضوع قريته من كتاب صغير بوكيت بوك أو شفت فيديوهات علي حسيب، بعدها دخلت لبيلي أند لاف راح يسهل لك الوضع بشكل جدا رهيب. إذا بتدخل على موضوع جديد هيك من بداية بيلي أند لاف يعني احتمال كثير كبير تطول بالمواضيع كثير. تمام. فإذا قريت الموضوع قبل ما أدخل على بيلي أند لاف، قريت الموضوع من كتاب صغير بوكيت بوك أو شفت فيديوهات علي حسيب، راح يعني راح تكون حياتك احسن بكثير. بس هيك. تمام. في online method, there's also another site, it's called online method. Some people يعني loved it. To be honest, I didn't use it and I don't know. I can't give you a feedback about it, but because I didn't view it, but some students like it. There's also Amboss and يعني YouTube for any, like for example, surgical techniques for operations, for anything that you need video to do so. There's also YouTube, of course. طيب أي سؤال على قناة علي حسيب أو لحد الآن يعني؟ هو صح. There's one important note. Don't يعني هو فيديوهات علي حسيب رائعة to give you the concept, to understand the concept of the surgical cases or of the surgical techniques and the operations. It's amazing so that you can read it from Bailey and Love and understand it. Because if you read the surgical technique or operation directly from Bailey and Love, most probably you will understand nothing. Okay, so it's very amazing to build your concept about these topics. But again, don't take the recent guidelines, take it from only the books. لانه الفيديوهات هي شوي قديمه، بعض الشغلات الصغيره يعني few indications او الريسنت جايد لاينز لا تاخذوها منه، يعني stick to your reference which is Bailey and Love. تمام؟ يعني هو رائع واسطوري to build your concept، بس الجايد لاينز الانديكيشنز الشغلات هيك الدقيقه اللي بدها تعداد بدها تكون دقيق فيها، خذها من الكتاب تاع المصدر. تمام؟ طيب ليش عمر؟ طيب so as we said, Bailey and Love is the main reference to you, and your doctors will recommend it also to you, and you will have, we had many questions that wasn't present in any other resources other than Bailey and Love. That's why you should focus on with what the doctor is saying and explaining and is stressing on, so that you can read it from Bailey and Love and save your time and study smartly. There's also Step Up to Surgery. It's a concise book يعني زي تشرشل اللي هو تشرشل بوكيت بوك. كمان اي توبيك ما انك ملحقها تقراها من Bailey and Love، او توبيك ما لقيت فيه عليها اهتمام كثير من الدكاتره وكذا ممكن تقراها. في هذا Step Up to Surgery، وفي عندك التشرشل بوكيت بوك as we said. There's also مطري اللي هو in general surgery. Also many students يعني like it. مشكلته بس هذا شوي قديم، يعني الكلام فيه احيانا بيكون قديم، بس برضه بيعطيك يعني المواضيع مرتبه فيه بطريقه بتعطيك كونسبت رائع للموضوع قبل ما تدخل تقرا Bailey and Love. يعني بعض الطلاب استخدموه وعجبوني كثير، ويعني فعلا كان في كثير مواضيع مشروحه فيه بطريقه يعني ممتازه. تمام؟ عندك يعني resources other than Bailey and Love. We have Principles and Practice of Surgery and we have Schwartz. تمام؟ هدول يعني these are the large textbooks like Bailey and Love. So you can use these. I recommend using these only for your, for example, if you have a certain supple or a certain presentation that you didn't find much information about in Bailey and Love, or you can يعني go through these very quickly to see if there are any شغلات ما موجودة في Bailey and Love, tables, graphs. إني كتب رائعة، خاصة شوارتز يعني صراحة رائع، بس للأسف your reference is Bailey and Love. So stick to Bailey and Love, but these are other options that you can review in certain topics. في عنا Surgical Recall، هذا كتاب رائع كمان للمراجعة. عبارة يعني it gives you the topic and it gives you questions under it. يعني بيعطيك أسئلة على التوبيك وبيعطيك ريفيو لإلها بكم صفحة عن طريق أسئلة، سؤال جواب سؤال جواب سؤال جواب. فمراجعة رائعة. وعندك آخر واحد تبع MCQs and AMQs in surgery، عبارة عن it consists of questions from Bailey and Love chapters. So you'll have Bailey and Love chapters. Under each chapter you will have questions about these chapters. So يعني for train. Okay, Bailey and Love is the main reference. Again, yes, and take notes. Again, lecture supple seminars, notes. Yes, please. Yes. Muhammad has a question. Walid?
Yes, assalamu
alaikum.
Doctor, regarding Bailey and Love, I believe one of the senior students had written a summary, and many of
yes,
the students I know, they recommended that summary and they and they praise it. So
yes,
have you gone through it, or do you know about it?
Yes. There are like summaries for Dr. Adnan al-Nasr and for Dr. Halawi. They were great in many topics. بس هذول يعتبروا كيف بدي لك يعني زي دامج كنترول بلان. تمام؟ يعني اللي هو انت خلاص الاختبار قرب، ما عندك شيء، ما انك ملحق تراجع، او بدك تراجع شيء على السريع. تمام؟ او موضوع ما لك قاري من Bailey and Love، وبرضه بدك يعني تعرف شو هي الشغلات المميزه الموجوده في Bailey and Love يعني that's not present in other resources. ممكن تروح يعني فيهم. كثير كانوا بكثير مواضيع مميزين ورائعين. تمام؟ لخصوا كثير مواضيع بطريقه حلوه جدا. تمام؟ وكثير يعني كانوا جدا رائعين فعلا الصراحه. بس يعني مثل ما قلت لك هذول يعتبروا خطط طوارئ، يفضل يكونوا خطط طوارئ. يعني حاول انت من البدايه تنظم وقتك وتشتغل بكل طاقتك بحيث انك ما تضطر تدرس مواضيع كامله منهم. تمام؟ بس اذا عندك اياهم يعني رائعين جدا، ممكن تمر عليهم على السريع يعني يعني I recommend it. تمام، بس ما يكونوا your main يعني resource اكيد، بس لحالات الطوارئ. طيب عفاف تفضلي.
Yes, Doctor. I have a question. Is there any reference or a book to review before study surgery?
ريفيو بوك؟
Yeah.
ايه تمام، مثل ما قلت لك في اللي هو تشرشل بوكيت بوك، هذا فيه يعني بيشرح لك المواضيع بشكل مختصر كثير ورائع. وفي عندنا ستيب اب تو سيرجري، هذيك هاي عم تفرجيكم يا عمر تشرشل بوكيت بوك. ايوه هذا هو. تمام، هذا جدا رائع، هذا حتى لو مواضيع ما لحقتوا تقروها من بيلي اند لاف لو بتدرسوها منه يعني خرافه. تمام، في هذا وفي ستيب اب تو سيرجري كمان. تمام هذا.
Yeah, Doctor. I mean, from the previous year, يعني, is there anything I need to review?
يعني certain topics from the previous year.
Yes.
يعني not likely because مش كثير، لانه المواضيع اللي راح تاخذيها كلها يعني قصدي انه يعني قصدك هلا بالصيفيه يعني ولا بدايه السنه؟
كيف دكتور؟
شوفي بالسنه الجاي يعني موستلي كلها عباره عن كلينيكال. تمام، ولازم تدرس المواضيع كلها مواضيع من مصادر كلينيكال. تمام.
Yes.
اللي عنده البيزكس ضعيفه شوي او يعني مثلا ناسي اشياء من البيزكس، ابدا ما يوقع بغلط انه يرجع يراجع الموضوع من الاول اساسياته من البيزكس لانه ناسيها. تمام، ترى راح يضيع وقت يعني كثير راح تروحي وقت. تمام، يعني حاولي اذا بدك تراجع موضوع you can review it very briefly from for example a YouTube video just to remind you of the basics that you already studied and know. Okay, and study from these references because يعني they have يعني clinical هذول يعني السكوب تبعهم clinical اكثر.
Okay دكتور thank you.
طيب yes هذول next please. طيب في كان عندنا اللي هو الميني سي اكس اور باتش يعني برضه didn't have this، ما اخذنا الميني سي اكس. الاختبار عباره عن زي فورماتيف يعني تيست يعني اختبار بس هيك تدريب ما عليه درجات. بتاخذ عليه ورقه تقييم زي الصوره محطوطه على اليسار عندكم. عباره عن انه الدكتور بقول لك روح على المريض. تمام، بتاخذ منه هيستوري وفيزيكال وهو بيتابعك كيف انت عم تاخذ هيستوري وفيزيكال اكزامينيشن وبقيمك. بعدين بتناقشوا طبعا بعد ما تخلص تناقشوا بالديفرنشال والانفستيجيشن والتريتمنت. راح يقيمك طبعا وبيعطيك زي هاي الورقه. بتحفظ هاي الورقه وتصورها بتاخذ منها نسخه مشان تحطها بالبورتفوليو. لازم هاي الورقه ينضاف قسم جديد بالبورتفوليو على الميني سي اكس بحيث انه تحط هاي الورقه فيها تقييم. وبس هذا الميني سي اكس زي ما حكينا في مره بالاسبوع. جروبنا ما اخذوا يعني بسبب انه كان وضع المشفى عندنا مخربط. الجروب الثاني اتوقع اخذوا الباتش الثاني، فانتم ممكن يسوي لكم اياه ممكن لا بالسيرجري حسب الوضع. بس يعني هاي فكرته بكل بساطه بتكون غالبا اخر يوم دوام مشفى بالاسبوع يعني مثلا 4 غالبا يوم الاربعاء بس. ما عليه درجات بس. طيب عفاف do you have a question or...
No دكتور thank you.
Okay. تمام next one please. طيب this is the assessment plan for our rotation. We had our first MCQ and MEQ in the 5th week. We have the mid rotation, mid clinical exam and mid oral exams on the 9th week. And we had our second MCQ and MEQ test on the 10th week and our final in the end rotation assessment. الدرجات كانت 50% for continuous assessment and 50% for end rotation exam. الكونتينيوس اسسمنت كانت عباره عن السوبلز والسيمينارز وشيء اسمه written communications. عباره عن انه بعدين بصير يقول لكم انه سلموا 3 discharge letters 3 referral letters and 3 prescriptions. ما راح تكون بدايه الروتيشن يعني بوقت متاخر شوي. بس يعني شغلتها بسيطه. عندكم الام سي كيو والام اي كيو اختبارين اول والثاني، وعندكم اللي هو الميد كلينيكال اكزام وميد اورال اكزامز. هذول كلهم continuous assessment 50%. ال 50 الثاني هي الاند روتيشن اكزام، ام سي كيو ام اي كيو ريتن، وكلينيكال عندكم اوسكي اوسبي واورال كمان. بس هي كان بخصوص الاسسمنت، ممكن تغير شوي عندكم بس يعني. طيب بليز. طيب هلا عندنا الراديولوجي، هذا كورس رح تاخذه at the same time with the surgery. دكتور محمود تقريبا محبوب سوري. 15 lectures 2 hours 2 exams only, midterm و final. Review the questions. The exam يعني had almost 95%. It was the same of the previous exams. So very important, revise the previous tests, revise the previous exams. The only reference is your lectures. Your radiology lectures are more than enough for your radiology course. You will have it at the same time as the surgery rotation. طيب إبراهيم تفضل. Question.
تفضل. For example, if I يعني studied for the surgery, I يعني went through Dr. Al Hasib videos, then I opened small book, then I opened يعني Bailey and Love.
طيب.
We studied the seminars و Subels.
تمام.
At the end of the week, I want to review. What's the most effective way يعني to review what I studied from different books, videos؟ يعني أحسن طريقة حتى راجع فيها.
والله يعني الريفيو يعني هي امر شخصي شوي. تمام. ممكن هذا مره ثانيه بنحكي اللي هو تشرشل بوكيت بوك، يعني حتى بيلي اند لاف اذا قريت منه موضوع يعني احيانا صعب كثير حتى تقدر تراجع منه طويل. فعندك هذا تشرشل بوكيت بوك هو اسطوره للمراجعه بالماي، والستيب اب تو سيرجري برضه نفس الشيء زي ما حكينا. تمام. اذا عندك نوتات كمان، النوتس اللي اخذتهم الدكاتره كويسين. تمام. بس يعني نحن يعني ان شاء الله يكون عندك وقت لانك مراجعه، يعني اذا كان عندك وقت المراجعه يعني انت بالسليم. تمام. ايه بس يعني هي الريفيو بوكس اللي يعني اكثر شيء يعني ممكن تستفيد. تمام. وفي نصيحه ثانيه، بيلي اند لاف مثلا موضوع ما لحقت تقرا منه، تمام، ممكن تمر على في بيلي اند لاف مربعات بحط لك الكي بوينتس بعد كل موضوع، بيعطيك كي بوينتس وبيعطيك يعني هيك الزبده تبع الموضوع. وفي فيجرز وصور وتيبلز. تمام. يعني نسبه كثير كبيره من معلومات الموضوع بتكون بس محطوطه بالتيبلز والفيجرز وهي الكي بوينتس بوكس. فاذا الموضوع مثلا انت ما لحقت تقراه وقريته مثلا من كتاب صغير، ممكن تمر على هاي الكي بوينتس والفيجرز والتيبلز، ترى راح تعطيك جدا معلومات، تعطيك يعني معظم الزبده المكتوبه كتابه. فهي ممكن كمان تعملوها. تمام. طيب تمام تفضل.
طيب هلا بخصوص السيرجري، لأنها هلا باقي لنا تقريبا ابو اسبوع ونص، يعني بس اذا بدنا نبني بس شويه كونسبتس عن السيرجري، يعني ابدا علي حسيب ولا شو اعمل؟
علي حسيب ترى ممتاز جدا، ممكن تبدا فيه. تمام. يعني بيعطيك كونسبت وبيشرح لك بطريقه جدا بسيطه، ممكن تبدا فيه. ممكن برضه حتى تشرشل بوك ترى كويس، يعني بيعطيك فكره عامه حلوه. يعني انت البيزكس عندكم هلا بهي المرحله كويس، يعني تشرشل بوك كمان ممكن، او ستيب اب تو سيرجري برضه يعني راح يعطيك فكره كثير كويس. بس يعني اذا ماي ريكومنديشن اذا عندك وقت شوف علي حسيب.
حلو.
تمام. انا يعني علي حسيب راح يكون اذا بدات فيه من هلا بكون شيء اسطوري.
تمام.
يعني بحيث الواحد بيكون جاهز انه يبدا يقرا من الكتاب مباشره. طيب الراديولوجي زي ما حكينا موضوع ايزي بيزي ان شاء الله، يعني lectures study lectures previous exams خالص ان شاء الله. يعني هاي ايزي A بلس يعني بالراحه، اذا ما A بلس A اذا طبعا الواحد درس يعني بس. طيب next please. طيب تفضل ابراهيم.
بالنسبة للراديولوجي كافية المحاضرات ولا لازم ريسورس
ثاني؟ لا كافي وزيادة.
بس من المحاضرات
وزيادة الأسئلة ناس خلصت من المحاضرات وحتى ناس خلصت من الأسئلة السابقة يعني بس. تمام. طيب تفضل next عمر بليز. طيب درماتولوجي عنا آخر كورس أنا راح ألقي لكم إياه، كان بإشراف دكتور عتيبي ومخلف والبشري. طبعا الراديولوجي والدرماتولوجي بإشراف دكاترة من جامعة القصيم. تمام. فلذلك يعني جدا وضعهم ايزي يعني لو بتدرسوا محاضراتهم خالص السلام عليكم. تمام. درماتولوجي 3 اسابيع لساعتين نفس الشيء. ميد تيرم وفاينل محاضرات خالص، محاضرات نوتات خالص السلام عليكم. وطبعا ريفيو كويستشنز كل شيء اللي في راح تلاقوا بالملفات السابقه ملفات لجامعه القصيم، اختبارات الكلينيكال، اختبارات الاوس بي الاوسكي، يعني لازم تشوفون، لانه في مواضيع اذا ما قريت من الاسئله السابقه بتحس حالك ما راح تعرف تجاوب ابدا، ترى وهو فعلا ما راح تعرف تجاوب اذا كنت بس عم تقرا من المحاضرات. تمام. فمحاضرات مع اسئله سابقه خالص اي بلس يعني ايزي بيزي ان شاء الله. تمام. طيب اي سؤال؟ yes, his video is good. Sorry, which books do you mean? Only the lectures by lectures بيعطوكم اياهم يعني الدرماتولوجي. Okay. You're asking in the chat. تمام. طيب, do you have any question for surgery, radiology, dermatology? Yes, ابراهيم تفضل.
كتاب الدكتور علي حسيب يعتبر يعني وين موقعه من هالكتب هي حكينا عنها؟
في له موقع علي
لا
حسيب.
قصدي ما قصدي موقع، قصدي يعني انه هو كتاب شو يعتبر يعتمد فيه مثلا على التحضير المراجعة، هيك
هو
قصدي كتاب
والله
الدكتور علي حسيب.
شوف، هو بس مهمته كلها يعني، حتى في طلاب كانوا ما يفتحوا كتابه حتى ماشي، بس انت افضل نزل كتابه بحيث تشوفه اثناء الشرح، يعني ممكن مشان ما تكتب كل شيء وراه نوتات تعذب حالك، نزل كتابه افتحه بنفس الوقت اللي عم تشوف فيه الفيديو، وضيف على كتابه مثلا نوتات معينه انت بدك تكتبها. حلو. مثل ما حكيت علي حسيب يعني بس مهمته الاساسيه فقط مشان يجهزك ويبني الكونسبت عندك انك تدخل كتاب كبير او مصدر ثاني تقراه، انك تفهم بس يفهمك من الاخر. حلو. بينما يعني احيانا بعض المواضيع او بعض المعلومات اللي بيحكيها ترى يعني شوي ممكن تكون قديمه او شوي فيها مشاكل مثلا او شيء، بس يعني لا to build your concept it's يعني amazing. تمام. بس يعني الصراحه I don't recommend his books. تمام for your يعني انه يكون الريفرنس تبعك الاساسي. I don't recommend that. recommend المصادر اللي بتعتمد عليها اللي حكينا عنها، تشرشل بوكيت بوك، ستيب اب، وبيلي اند لاف.
تمام.
طيب اي سؤال ثاني للسيرجري راديولوجي درماتولوجي؟ طيب اعذروني على الايطالي، يعني حاولت اجمع لكم كل شيء نصائح ممكن تفيدكم بهذول 3 rotations. Now with the internal medicine with my colleagues Omar. Thank you for your patient listening, and I wish you the best of luck in your coming year.
شكرا.
we have here a question from Ghada. Surgery or radiology بيمشوا مع بعض. Radiology you will have one lecture each week. Each week you will have only one lecture. For us, it was online. For you, I don't know if you will have to attend it in the college, but yes, one lecture each week. That's it. And the exam, it's after the surgery. After you finish the whole surgery exams, you have your radiology test, I believe. Yes, that's it.
Assalamu alaikum. Good evening, everyone. Is my voice clear?
Yes, clear.
Okay. In this part of our presentation, I will talk about internal medicine, emergency interpretation, and orthopedics. So, internal medicine, as surgery, is one of the most important courses and rotations in fourth year. Internal medicine also is considered as a huge, a rotation with a huge content. And at the same time, for many students, it's the most amazing rotation and the most interesting one. And also, if you and internal medicine is the best.
Your voice is cutting them.
Hello, guys. Can you hear me?
Yes.
Yes.
Okay. What was the last thing that you heard?
You were giving an introduction
about internal medicine as being interesting.
Okay. طيب, internal medicine is يعني an interesting rotation, and it's considered as the best rotation for many students. يعني because of the regulation, because the organization, and also the content and the materials that the students receive in the internal medicine. Internal medicine will be with Dr. Awayed. He was the coordinator for our batch, and Dr. Hussam, Dr. Shahid as well. So most of the seminars, most of the SUBs and the lectures will be with them. Some lectures and SUBs were with Dr. Munira, and also she will be with the female side in the hospital. Dr. Adel, Dr. Kashan also joined us in some hospital visits. So what is internal medicine? Internal medicine in general is a rotation with a huge content, as I mentioned earlier. It consists of 14 weeks, and for those lucky people, it will be with 16 weeks. So the vacation will be included with the internal medicine rotation. In internal medicine, there are different topics you will face. Mainly, it's the same concept of surgery. So most of your study, most of the learning will be with the self-study. Then you will have the hospital visits, along with the lectures, seminars, and so on. Of course, the most important thing in the internal medicine is the lectures, along with the notes. So the lectures are, you should look at the lectures. I can say 70% to 80% of the exam content. And, yes, please. Is there any question or something? Okay. طيب مثل ما كنا عم نقول انه الليكتشرز هن اهم الاشياء الموجوده بالانترنال ميديسن. تقريبا every week you will have like 3 to 4 and sometimes 5 lectures. Most of the or the most important topics will be explained in these lectures, and you must take notes. Listen to the doctors carefully. Many questions were from these lectures, from the comments that they add. Also, in the hospital visits, they are also very important. And I can say these notes are important for life, not even just for the exam. So, for example, I just had an elective rotation in a hospital after 4th year. And I can say many things that you will see in the hospital, the guidelines, these small tips that the doctor add, they will be of high value in the hospital and in your career. And of course, many students or many doctors that graduated also say the same thing. Okay, so our week starts with Saturday, for example. As Anas mentioned, you need to review how to take history. Yes, even if you are, for example, confident enough that you will face, for example, a case of COPD or, for example, of asthma exacerbation, and you know how to approach to cough. No, please review it again and build the differentials. Just make a concept how to take history. Physical examination is also important. In general, you will take physical examination or clinical skills sessions on Thursday. For example, with Dr. Shahid or Dr. Sam. and sometimes with Dr. Awayed. So review it again, read about it. It's very important here to prepare yourself for the hospital days. Why is that? In the hospital, you will first go to a patient. The doctor will say, okay, go to room, for example, 10C. And after that, he will ask you to do history and physical examination. The doctor will be in front of you. So in medicine, especially in surgery, we didn't have such a thing. The doctor just sent us for the patient, and then we discuss the findings and the history. While in medicine, most of the doctors will be with you. For example, in one day, I went with Dr. Awayed. So Dr. Awayed was beside me. Then I took history in front of him. He asked me to do an examination, and also he will teach you how to do some special skills that you don't even know from the books or any resource. So the hospital visits are very important. So you need to prepare well for it. You need to attend as much as possible, and also prepare yourself to make a discussion. So whenever you see a case, you will discuss it. First, you will take history in front of the supervisor or doctor. Then you will do physical examination, starting from the general examination to specific examination. And after that, you will discuss that topic. So we have in Monday hospital visits. These visits are of 2 hours, not like in surgery. No, they are of 2 hours. And you will see a lot in these 2 hours. For example, sometimes with Dr. Shahid, we talk about 4 cases in one day. So you'll see a lot of cases as compared to surgery. Then you need to take notes. Yes, of course, you need to take notes. And prepare yourself for lectures and seminars. How to prepare for them, I will tell you in just a few moments. But here, let's go to the next step. So let's suppose that we are on Saturday, and tomorrow I have a hospital visit. So first of all, you can read from any book of these to prepare yourself for taking history and to learn how to do physical examination. For me, I didn't have much more time to do all of these things. But for example, from Al-Bukhariya to Breda, it takes about 45 minutes to 45 minutes, 50 minutes. And at that time, I used to read from this book. So if you can have a copy in your mobile or a hard copy, it will be so helpful. You can prepare yourself in how to take history and how to approach to physical examination. This book is amazing as well, but it's too long. Yes, it's too long. So you can read some specific topics if you are interested. And I can't say many other words about this great book. This is very important. So in Monday, some students will go to the male medical ward. Others will be in the female medical ward or cardiology unit and dialysis unit. And some people will be with the outpatient clinic with a doctor from the hospital or a consultant in the hospital. In all of these things, you will take history and you will discuss some points. So as we said, يعني notes are very important. You need to take notes. You need to, sometimes the doctor will give you a feedback on your performance. So please write them and try to and prepare yourself to improve these things. After you discuss these in these notes or these cases, you will write them in the logbook, and there are a certain number of cases required to fill in the logbook. And these they are easy to collect because you will see a lot of cases in the hospital. What you will discuss, of course, history, physical examination in front of patient and your colleagues. Then you will have, after that, a short discussion. In that discussion, you will formulate the differential diagnosis, the investigations needed, and also the treatment. And sometimes doctor will allow you to take a look to the file to see what are the investigations given, the treatment, the definitive diagnosis. It depends on the situation. On Tuesday, we will have the lectures. The lectures, as I said, are the most important thing. Your first resource are the lectures. So please, if you don't have any time, don't waste your time with the seminars or SOBIS. No, go directly to finish these lectures. I know many students who just studied the lectures and they get a good mark, not an excellent mark. No, it was good mark because they did not study all seminars and SOBIS due to the shortage of time. So lectures are a must. Right. What to do with the lectures? Sometimes in the lecture you attend it and you listen to it, and you need some help with the visual resources for learning. So what are these resources? Of course, Medlayer. It is with Dr. Tariq Abdelhamid. It's an amazing YouTube channel and website. You can take a look onto it. Strong Medicine is also great also for internal medicine. بالنسبة لدكتور طارق عبد الحميد، دكتور طارق عبد الحميد بيدرس بأسلوب كتير ممتع، كتير وكتير مبسط. الفيديو بيكون مثلا ماكسيموم 20 دقيقة على سبيل المثال، وهو بيشرح بالعربي تقريبا، بالعربي كل المواضيع بالعربي. فالموضوع بياخذ معه 20 دقيقة وبيكون بطريقة مبسطة وسهلة الحفظ والفهم. فهذا المصدر كتير رائع كتير للمواضيع، ولكن لا تاخذه كمصدر أساسي لتريتمنت. مصدرك الأساسي هو الليكتشرز، لأنه المواضيع هون المعروضة قديمة من 2016 2017. Strong Medicine also have old topics and videos. So don't rely on them. Just take the concept as we mentioned earlier. Then you can take a look to the lectures. The lectures are very, very, very important. طيب، if you need sometimes beside the lectures, if you need more knowledge, what do you want to do? Of course, there are many books like Comar, Essential Comar, and this book as well, Current Davidson. Yeah, they are very helpful. But for me, Comar was too long. I read from Comar many topics, especially the treatment part. Yeah, but also, if you read from USMLE Step 2, First Aid USMLE Step 2, CK, it was a great. Yes, it was it was great. Of course, if you need perfection, Clinical Medicine of Comar is your resource. But here in internal medicine, you have about 150 topics. So imagine if you read all of these things from Kumar. Yani, some people did, but I don't think from our batch, from previous batches, they read all topics from Kumar. Yeah, but yani, first aid will be great. Also, Oxford Handbook of Clinical Medicine, also a great one. I didn't use this book, but many students also said it's very good. Step up to medicine. So this is in Tuesday. In Tuesday, as I mentioned, you will take some lectures, seminars. Okay. You will take some lectures and seminars. In the seminars, they are mainly approach, as we mentioned earlier, approach to abdominal pain, approach to vomiting, approach to constipation, whatever. So you will just bring a case. If you have a presentation, and this presentation was a seminar, so you will bring a case, and in that case you will talk how to do history taking and what do you expect to take from that history. Then you will write about the physical examination. So what are the signs that you expect to pick from that case, or from that case, or from that presentation. After that, you will formulate your differential diagnosis, and then you need to exclude these differential diagnoses. So what is the lab value that will exclude that one? What is the sign that will confirm that this topic is, or this disease is responsible for that presentation? So this is the seminar. And also, yes, you need to take notes. In our batch, I read a lot from seminars from my colleagues' presentation. So please, try to make a great presentation or a good presentation so your colleagues can read from it. Of course, I'm sure that the doctors will give you a feedback and will ask you to make some modifications or add some points, and all of these will be helpful. But if you make some effort, that will be great. So for me, how I did in seminars or in SUBELs, in seminars, for example, if I had a topic to study, and it's not about my own presentation, so someone else just presented it. So how I prepare myself to study it? Of course, first of all, I open like Midler. If it is there are a topic relevant there, and after that, I started with the first aid, and I read everything from there, and I highlight the clinical features, signs and symptoms from the first aid. And sometimes in some topics in first aid, for example, the investigations or the treatment are not up to date. So you can take a look into the treatment part in the Kumar Clinical Medicine. And believe me, it's not too long. Most of the topics, just half a page will have the treatment, except in some topics like in asthma and COPD. But don't worry, these topics will be presented in a great way in the lectures. But regarding SUBELs and seminars, treatment could be read from there. But here, it's great. Yeah, it's very good. I think we have a question. Okay, could you repeat? Okay. Yes. طيب أحمد، هو الفكرة إنه دائما بالانترنال ميديسن خلينا نقول إنه البرفكشن صعب الوصول. الكومبليشن هو أهم. فأنت لو جيت مثلا عندك سوبل بدك تدرسه، زميلك قدمه بطريقة ما، بس أنت حابب إنه يكون عندك مصدرك لحتى تدرس منه. الكتب الريفيو يعني كانت بالنسبة لي رائعة، وكثير من المواضيع كافية، وكثير من المواضيع حتى ما ألحق إنه مثلا أدرسها من كتب كبيرة. فشو كنت مثلا أعمل، وكثير من الطلاب هيك يدرسوا من فيرست ايد ستيب تو ميديسن أو من أكسفورد، ويكون نوعا ما كافي، في كثير من الأحيان كافي. بعض الأحيان أنت محتاج مثلا إنك تدخل في كتب كبيرة مثل اللي هو كومار أو ديفيدسون. الدكاترة بيفضلوا عنا كومار، يعني كثير من الأحيان بيفضلوا كومار. حتى أنت وقت تقرأ من ديفيدسون بتحس إنه شوي طويل وأسلوبه معقد شوي. كومار سلس بسيط يعني وقصير يعني نوعا ما مقارنة بغيره. فمثلا لو أنت حابب تستزيد بالانفستيجيشنز بالتريتمنت من كومار، الشيء الأمثل إذا كنت والله قادر إنك تدير وقتك بشيء كثير مناسب، يعني مثلا مناسب لك بحيث إنك تلحق قراءة كومار. كومار هو المصدر الأساسي، كومار ديفيدسون أو حتى هاريسون ممكن. في هذا الكتاب recommended with من دكتور عويد، لكن هو طويل بعض الشيء، كثير مواضيع كثير بيكون فيها يعني معروضة بشكل جميل ورائع، فبتقدر تقرأ منه. لكن أنت رتب أولوياتك حسب الوقت. يعني مثلا لو كنت والله واصل يوم الاثنين وأنت مخلص كل المواضيع، فأنت مخلص كل المواضيع يوم الاثنين مثلا، أو لا مرتاح مثلا إنه خلصت 50% من المواضيع، ومن وين مثلا؟ من كومار. تابع من كومار ما في إشكال. ولكن لو وصلت يوم الخميس وأنت متراكم عليك كم هائل، لا تقرأ من كومار، لأنك راح تضيع وراح تضيع وقتك. فممكن أنت تستعين بكتب الريفيو. تمام، إن شاء الله يكون واضح. في أي سؤال، أي استفسار بالنسبة للريسورسز كيف تدرس بشكل عام يعني؟ إبراهيم تفضل.
ساعة الله. هلا كتب الريفيو الدكاترة بيعتمدوها، يعني لو واحد مثلا إذا مثلا يناقشون بشغلة أو هيك بيعتمد بيقول له إنه بيناقش فيها، ولا بيقول له لا أنت فاتح كتاب ما منيح روح اقرا من كتاب ثاني؟
والله تمام، ممتاز تمام. بالنسبة للدكتور عويد يعني كان يقبل كتير هذا الريسورس. طبعا فيرست ايد ما أتوقع إنه ممكن يقبله، لكن الصراحة الدكتور عويد كان يقبل كتير بالأكسفورد. يعني كان يقول إنه لا بالعكس كويس وممتاز. حتى يعني مرة من المرات كان في سؤال فيه مشكلة، فكان النقاش إنه مصدر ما بين، أتوقع يعني مصدر بيعتمد الدكتور عويد وما بين هذا الكتاب، فقال تمام ارسلوا لي اياه وما في اشكال. فكان معتمد يعني. كان معتمد. فيعني لو انت لقيت حالك والله وضعك مرتاح، لا هذا الشيء الامثل. بس الشيء الامثل يعني صعب الوصول بكثير من الاحيان. فمثلا ممكن انه تبدا بكتب الريفيو. انا عن نفسي مثل ما حكيت لكم، ما اتوقع في يعني ما اتوقع انه في حدا كان ماشي على نفس الشيء صراحه. بس كانت تاخذ وقت كثير انه ادرس من فيرست ايد او مثلا ستيب اب تو ميديسن بعض الاحيان، ثم انه والله التريتمنت ما يعجبني، ما يكون معروض بشكل جيد، فاروح والله لكومر. بس وكومر التريتمنت او الانفستيجيشن يعني ما بيكون طويل عاده. انتم اتوقع فتحتوا كومر من قبل، فبتعرفوا انه كيف بيكون معروض. بالليكتشرز هذا طبعا فقط انا عم احكي على السيمينارز والسوبلز. اولويتك دائما الاولويه للليكتشرز. يعني دائما حاول خلص الليكتشرز واخلص من همهم وبس. باقي الاشياء لا، يعني انه تمشي يعني من كتب ثانيه. تمام. طيب اوكي. طيب هلا يوم الخميس عندنا راح يكون سوبلز you can prepare for them from any book you need, especially current or Komar. Sometimes you need up to date Ambos. يعني all of these can be helpful. طيب, what is the structure of internal medicine? First week will be introduction. There you will have a lecture about the labs, introduction to ECG, history-taking tips, and physical examination. General physical examination and cardiovascular examination. In the second week, also you have ECG as well. In the second weeks, you will have the cardiology theme. Here you need to take attention to ECG. And ECG is not asked too much in the internal medicine, just like 5 questions, 6 questions maybe in the OSPI. However, it's very important. Pulmonary function tests also are important in the respiratory week. Hematology and GIT in the 5th, 6th week. In the 7th week, nephrology, endocrinology, then rheumatology, neurology, infection. And there you will have a gray week. This gray week, you will have like some review lectures, review activities. They are very important. You will talk about the acid-base balance and the ECG. And in the last week, you will have the examinations. طيب, شو الأشياء اللي هو لازم نركز عليها؟ ECG مثلا. ECG is very important, and you need to. This is the last chance to learn about ECG, and of course the other things. So what do you need to do in the ECG? A very interesting resource is the Strong Medicine, but it was for me, I follow دكتور طارق عبد الحميد بقناة ميدلر، كمان بيشرح بالعربي. في فيديو أو في سلسلة من 3 فيديوهات اسمها فاست ريفيو، هي كانت كتير رائعة. هي 3 فيديوهات تقريبا 3 ساعات للأمانة، فيك أنت تجاوب على أي سؤال بعدها. خلينا نقول أغلب الأسئلة مشان ما نخلي نسبة للخطأ. في هي السلسلة الطويلة وأنا ما قدرت أخلصها لكن هي السلسلة الطويلة بتوصل ل 22 ساعة، بينما هي ب3 ساعات أنت بتخلص ونوعا ما مساعدة لك. بالنسبة للأسبوع الثاني أنت مطالب بالبلمونري فانكشن تيست، وبالأسبوع الأخير اللي هو الجراي ويك أنت مطالب تعرف اللي هو الأي بي جيز arterial blood gases. بالنسبة للبلمونري فانكشن تيست، سترونج ميديسن عنده سلسلة رائعة اللي هي 5 فيديوهات، أنت قادر بعدها تجاوب أي سؤال. الاي بي جيز صراحة هي سلسلة طويلة، أتوقع في إلى سمري ممكن تكون جيدة. طيب, بالنسبة للإكزامينيشنز، شو هن الإكزامينيشنز اللي نحن عنا إياهم؟ عنا بالأسبوع الرابع in the 4th week in the hematology week you will have your first midterm. Your first midterm is consists of 30 MCQs and 2 MEQs. So please pay attention to these things, because you need to study the theme, the topics of that theme, and at the same time you have an exam. So انتبهوا لهذا الموضوع بشكل، أو عفوا أتوقع هو بالأسبوع الخامس مو بالرابع، كان بالأسبوع الخامس أتوقع. فالفكرة إنه راح يضيع الفكرة إنه أنت محتاج تدرس الأسبوع وبنفس الوقت محتاج تحضر لاختبارك. فانتبهوا لهذا الشيء. طبعا 30 MCQs نوعا ما بسيطين. بالMEQs أنت مطالب تجاوب على ممكن signs, symptoms، أحيانا differentials. كثير من الأحيان differentials بتسألوك شو تعمل، list of investigations and of course the treatment. المواضيع دائما معروفة. أغلب الأحيان MEQs from lectures، MCQs most of them from lectures, and a few of them from SUBIDs and seminars. The same case is in the 9th week. And in the 10th week, we have the midi-clinical exam and mid-oral. Midi-clinical exam is exam in the hospital. هو exam بالhospital بيكون. You need to take history, then you will discuss that history with your doctor, and he will make evaluation. ميد اورال اكزام نفس الوضع تماما، يعني انه او عفوا مش راح يكون بالكليه، يعني in the college راح يعني there will be a specific topic like you will draw a paper and in that paper you will find, for example, a case or a presentation or a disease, for example COPD. Then the doctor will start to ask you some questions. You need to talk more about them. At the final exam week, you will have final MCQs, about 100 questions. Final MEQ, 6 MEQs questions, I think. Final oral, the same as mid-oral. Oral usually are from SUBES and seminars, but you need to ask the doctor before, because there are some changes. Also, OSCE will be there, and finally you will have OSPI. OSPI you will take it in the computer lab. Yes, you will take it in the computer lab. It will be about 30 questions or 20. Yeah, something like that. And you will have, like, for example, picture or a slide or video and some questions. In the OSCE, the clinical skills that you learned throughout the rotation. As you can see here, we have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. 11 exams. And your grade is out of 100. So imagine this situation. Many students took a good mark. Good marks, you can easily get good marks in internal medicine. But you need to study. Okay. This is the assessment plan in internal medicine rotation, but really it will, I think it will be changed. This because of COVID-19, but maybe there are some changes. The main, the final exam will only will take about. Sorry, where is the final? Okay, this is the final exam. Yeah, in the final exam, it's only about 23% of the total rotation marks. The OSCE is the same. Unobserved OSCE is OSPI. And look at these values. All of them are achievable. So, for example, here in this midterm, imagine that you have 30 questions on 7.5. So, it's a good thing. Okay. Of course, you need to get 60%. At least 60% in all exams. The end of the rotation or the final MCQs, MEQ, you need to take at least 60%. In oral, it's unlikely to take below 60%. And in the, for example, mid-oral or mid-clinical. However, the problem is in the written exam. Yeah, some people get, for example, 55% of the exam. And actually their grades, for example, was C. Let's suppose it's C or D+. But the problem that they took only 50% in the final. So they failed, yeah. The problem that they failed. بعض الطلاب مثلا انه ما بيقدروا يحصلوا على 60% من الاختبار، ف بيرسبوا. فهي هي الأشياء الجديدة اللي بتختلف عن السنوات السابقة، إنه أنت مطالب بكل إكزام إنه يكون عندك 60% and higher. تمام؟ فانتبهوا للموضوع يعني في البعض عنا مع الأسف ما عرفوا هذا الموضوع إلا بالنهاية. أوكي طيب في سؤال تاني؟ أوكي so يعني internal medicine يعني as I said it's very a great rotation, very helpful rotation. يعني واحد من أفضل الروتيشنز اللي أنا شفتهم الصراحة، واحد من أفضل الكورسات بإساريو. أنت قادر الصراحة إنك تتعلم بشكل كتير يعني الكلينيكال سكيلز أنا ما تعلمتهم من قبل، يعني تعلمتهم من قبل بطريقة خاطئة خلينا نقول. صحح كثير من المفاهيم عندي، تصححت كثير من الأشياء عندي، تصححت بالانترنال ميديسن. وهذا الشيء بفضل إنه والله مثلا الدكتور يكون واقف راسي مثلا وأنا عم أعمل فيزيكال اكزامينيشن فيشوفني عم أعمل غلط، فأنت قدامه عم تعمل غلط لا هو يجي يصحح لك. أحيانا بيمسك لك مثلا إيدك بيقول لك إنه اعمل لا بالطريقة الفلانية، السماعة امسكها بالطريقة الفلانية إلى آخره من هي الأشياء. فالصراحة أنا كتير استفدت من هذا الروتيشن من حيث الهيستوري. في يعني انت يعني باليوم الواحد عم تشوف مثلا 3 كيسات او خلينا نقول اقلهم كيس، اسبوعيا 3 هي اقلهم مثلا. فلا انت عم تتعلم، عم تاخذ هيستوري، عم تعيد، عم تكرر، فراح تتعلم من اخطائك، راح يعني تتعود. ومن حيث الاسسمنت يعني لا تخافوا، الموضوع كتير يعني الموضوع حب ان شاء الله والامور بتمشي على خير. والدكاتره الصراحه كلهم يعني يساعدوك وانت حط ببالك انه انسى الدرجات شوي، حط ببالك انك راح تتعلم، لانه الصراحه يعني الميديسن كثير من الاشياء يعني بتداخل مع كثير من التخصصات. السيرجري مفهوم لحال، لا الميديسن كثير مرتبطه باشياء. فحاولوا اسمعوا كويس للدكاتره، تعلموا يعني اسمعوا للاشياء اللي بيعطوكم اياهم، خذوا نوتس. شو بيقول هيك اشياء يعني بتحسها شوي غريبه سجلها، لانه راح تسمعها مره ثانيه، ان ما كان بالاختبار راح يكون بالحياه الواقعيه. فانتبهوا لهي القصص كثير منيح. خاصه الاشياء اللي بيقولها مثلا الدكتور عويد، الدكتور حسام. الدكتور حسام راح يعطيكم ليكتشرز اللي هي مبسطه الكل بيقدر يفهمها، وهي تقريبا ليكتشر تبعه ما بتتجاوز 60 سلايد. راح تكون ليكتشر مبسطه بطريقه كثير حلوه وراح تستفيد منها. الدكتور عويد عنده شغله كثير حلوه انه بيجيب لك الموست ابديتد، يعني مثلا لو شيء نشر امبارح واعتمد امبارح بيجيب لك اياه الدكتور عويد. فهذا الشيء الحلو انه انت بتكون ابديتد بالامور هاي. دكتور شاهد بيجيب لك مثلا سلايدات بسيطه ما تلاقي فيها كلام كثير، 20 سلايد مثلا، 10 سلايدات احيانا، لكن في كلام كثير يعني كثير في كلام. يعني انت تخيل 20 سلايد بساعتين مثلا او ساعه ونص، فهي بدها نوتس لازم تشتغل عليها. دكتور منيره راح تكون معكم يعني مين بالسوبلز والسيمينارز، اضافاتها كمان كثير جيده. دكتور عادل، دكتور كاشان بالمشفى، الفائده راح تكون معهم يعني بالاشياء انه الطرق الجديده اللي راح يعطوكم اياها لحتى يعني تعملوا فيزيكال وهيستوري. فالصراحة يعني إن شاء الله يا رب إنه يكون عندكم الروتيشن مثل ما كان على أيام. طيب الأورثو يعني هو طبعا أوكي الانترنال ميديسن هو عنده 10 ساعات 10 credit hours. طيب pay attention to these two rotations, surgery and medicine. يعني when you finish surgery and medicine يعني the most of يعني the rest of the rotations will be easy إن شاء الله. Orthopedics يعني will be with or was with Dr. Abdullah. It's 4 weeks rotation with the 3 credit hours. Mainly you should study from the SRU lectures. If you need anything else, you can see Arthur Ballet or Nabil Ibrahim. دكتور عبد الله من جامعة القصيم نفس المبدأ اللي حكى لكم إياه أنس، ليكتشرز والأشياء الثانية اللي بتعرفونها. فالموضوع يعني نوعا ما بسيط لكن يحتاج حفظ. احفظوا الليكتشرز بشكل كتير كويس. الميد تيرم was easy. The final wasn't. يعني it was literally from the lectures. محتاج حفظ بشدة يعني. فانتبهوا للموضوع. Here we have يعني other references, resources. I didn't use them. And the same case for most of the students. I only just opened them with my presentation and my seminar. Assessment, the new thing that there are marks for attendance for attending the lectures. So please pay attention to this. Many students خسروا درجات بسبب هذا الموضوع. طبعا attendance in all rotations is mandatory. But here it's mandatory plus it has marks. In emergency rotation, mainly was with Dr. Adel, Dr. Munira. Dr. Osman will be with you in the exam and in the hospital. Dr. Mona as well. Dr. Zulfiqar sometimes also can be with you. ER, I think all of you will take ER after medicine and surgery, isn't it? كلكم راح تاخذوا ER بعد medicine surgery ولا لا؟ في ناس قبل ناس بعد. الصوت مسموع يا شباب؟ تفضل محمد.
اتوقع اخر شيء سمعناه انه راح يكون بنفس الوقت سوا بعد
الإيار راح يكون بالاخير؟
لا بعد السيرجري على طول او الميديسن يعني بعد اول روتيشن.
بعد اول روتيشن
بالاخير.
Okay, and so for both groups, ER will be after medicine and surgery, right? Okay, that's a great. Yeah. Okay. Yes. And this is great news because in ER the main themes you have 5 weeks rotation and the main themes are medicine, surgery, OB/GYN, pediatrics, toxicology, forensic medicine. Mainly most of the exam questions and most of the focus is on medicine and surgery. So if you take medicine, surgery, then ER, it will be easier. It will be easier. So the most important thing here is notes. Notes are very important. Also, you will have some lectures. Of course, these lectures are your first reference. To read from books, sometimes you need to read some books. And these books are, there is Oxford Handbook of Emergency. It's very simple and short book for emergency. For me, I didn't prefer it. I read from Tintinelli. And in Tintinelli, don't waste your time in reading each word and each sentence in the book. No, directly go to the investigations and the steps of management. In the ER rotation, there is a special approach, like A, B, C, D, E. you will follow it in any disease and in any case. So the best thing you can do is look to this book, and it's very great and helpful. Okay, so this is the end of our presentation. Is there any question?
الله يعطيك العافية عمر. بالنسبة للسوبلز اللي هم فيهم الابروتشز، هل التوبكس تبع الابروتش هم نفسهم تبع السيمينار؟ يعني مثلا لو فرضنا انه عندنا بالسيمينار حنحكي عن يعني اذا عندنا بالميديسن حنحكي مثلا عن الجول ستون، هل حناخذ الابروتش تو بيشنت والجول ستون ولا لا الابروتش لشغلات ثانيه مواضيع توبك ثانيه؟
الابروتش is for the presentation، يعني for يعني جول ستون لا ما راح يجيك سيمينار، لا. الابروتش هو مثلا راح يجيك والله right upper quadrant pain. تمام؟ how to approach to patient with right upper quadrant pain.
يعني عنوان عريض بيجي تحت منه الامراض اللي حناخذها بعدين.
بالضبط. وانت بالسيمينار انت مطالب انك والله شو الاشياء اللي انا بدي احطها براسي اذا اجاني واحد right upper quadrant pain، انا شو بدي اتخيل شو معه هذا الشخص. تمام؟ يعني هذا الشخص مثلا right upper quadrant pain راح يكون معه مثلا احتمال ايش؟ احتمال ممكن يلا كوليسيستايتس، احتمال اللي هي ascending cholangitis، sometimes يعني يلا انه مثلا بنكرياتايتس مثلا هي لا ما اتوقع، مثلا احيانا appendicitis. كل هاي الاشياء بدك تعملها بدك تحطها ببالك وتحكي عنها، لكن باختصار according to what? According to the history and physical examination. So in history, what do you expect to see with the patient with ascending cholangitis? So I expect to see like fever, like right upper quadrant pain, like vomiting, and these things, chills, etc. In the physical examination, okay, in the physical examination, in the acute cholecystitis, positive Murphy sign, for example, high temperature, tachycardia, and so on. This is for the seminar. In the Sobels, no. You will have, for example, gallstones. Okay? You will have acute cholecystitis. You will have biliary, not gallstone, it will be biliary colic, I think. So, yani, Sobels for specific topic and seminars for presentation. Is that clear?
واضح. الله يعطيك العافية.
الله يعافيك. سؤال ثاني؟ في أي سؤال أي استفسار؟ طيب عموما يا شباب إن شاء الله يعني ما بتشوفوا إلا كل خير بالسنة الرابعة. السنة الرابعة مرة ثانية أنا بحب لكم إنه سنة كتير رائعة الصراحة الأمانة بالنسبة لي وبالنسبة لكثير من الطلاب. السنة الرابعة كانت أفضل سنة، يعني صححت كثير من المفاهيم بسنة رابعة. كثير من الأشياء مثلا الفيزيكال اكزامينيشن أشياء غلط كنا ناخذها، أو بالأحرى إنه مش يعني نحن مفكرينها صح لكن هي غلط. ف الصراحة يعني لا صححناها بسنة رابعة، كانت كثير رائعة. سنة رابعة أنت فعلا بتحس حالك دكتور. تمام. Please guys يعني I send a link in the chat box, and here in front of you you have a code. You can scan it. This is for evaluation for us, me, Anas, and Bara. So please, it will not take a lot of time. Just 2 minutes. So please, if you can fill it, that will be appreciated. Thank you so much. Is there any question? اوكي
الله يعطيكم
العافية.
العافية.
مشكورين، يعطيكم العافية.
يعطيكم العافية على الحضور ونشوفكم إن شاء الله على قريب. موفقين إن شاء الله.